He was diagnosed with dilated cardiomyopathy about 2 years back, and he was being managed with an ICD implant and other medication. However, his condition worsened all of a sudden on 24th of January this year. 25th morning we took him to the hospital in east of Kailas, but his condition continued to deteriorate. So much so that by 27th we were told that there is no chance of his survival. On 28th morning he was brought here in a stage what is called end-stage heart failure with multiple organ dysfunction. You can easily understand the mental agony of a father, mother, and the entire family, because he has got 2 young kids. One is only 3 plus, the other is 7 plus.
As a mother, I just had my kids' face, and that they kept me moving.
Mr. Shubhankar is a 38-year-old male. He came to another hospital with a multi-organ failure, and he's a known case of end-stage heart failure for the last 2 years. When the doctors over there, they told that patient is going to die in next 4 to 6 hours because of the medical condition of the patient. When I went over there, I examined the patient. It looked to me if we can manage this patient with the medical management and with some mechanical support. I shifted the patient from another hospital to our Max Saket, and we medically with the mechanical support we could manage. After 6 days, patient got better. But for the permanent solution, I offered them the 2 things. One is heart transplantation and another is left ventricular assist device. Because of paucity of organ donation in this country, the availability of heart is not there, so we had to go for the left ventricular assist device.
When he was being brought here, I was not at all convinced that there would be a miracle.
Those patients who have end-stage heart failure, their heart does not pump the required amount of blood. So, due to that, there is a low perfusion to the other organs, and the other organs start dying. To avoid this thing, one has to put a ventricular assist device or do the transplant, so that the perfusion to the other organs get better. The purpose of this device is to take blood from the main chamber left ventricle and give it to the main aorta, the main artery, so that the blood is perfused to all over the body as like a normal person.
He got this surgery done, and yes, it has accepted his body. The body has accepted the new device, and it's functioning.
Once we put the device in and patient recovers from the surgery, he goes home. He does all the normal activity what the other people do around in the surrounding. So because this device provides as much as blood like a normal heart, like a 5 liter of blood to the body, so perfusion of other organs get better, and he can lead a normal life like the other human beings are doing. The surgery went for almost 6.5 hours. After that, patient got better, and now the patient is ready to discharge, moving all around, and is doing a normal life.
On the following day, which happened to be his birthday also, at 7 p.m. I told you, I developed taking a faith, possibly also on an invisible hand, which I don't recognize. And that invisible hand possibly worked only to human beings, and that human beings are the doctors of the Max Hospital.
Max as an organization has vision to bring technologies of finest quality to improve human life. We have a multidisciplinary team in cardiac surgery and cardiology. Those provide a comprehensive approach to heart failure patients, which includes ECMO, which is an extracorporeal membrane oxygenation, ventricular assist devices, heart transplantation, and ambulatory balloon pumps.
Now, the recent times that machine has started adapting the body part and functions, I feel good, but it's a mixed feeling. It's a machine, So you never know if the machine falters, what happens next. So that's what I can say. So, but I'm having a healthy life. But as such, the challenges are with the numbers what the machine has. So sometimes I feel the numbers are dropped. So I feel that I'm also feeling a bit dizziness kind of thing like that. Otherwise, as such, there is no other challenge which I faced. The doctors were pretty good, friendly. Normally, you don't see such kind of doctors. In fact, I would say personally that Dr. Kewal is very friendly and he is very energetic. Other doctors, Dr. Rajneesh, they are the ones who listen properly and they really take care of you. And so I think the Max is the best hospital, and I give thumbs up to all the doctors.